Hey, thank you so much for tuning in. Before I kick off the show tonight with our amazing guests, I want to talk about, it's got tacos all over my shirt. I want to talk about our amazing sponsor, Smile Sonica. If you have not yet heard about Smile Sonica, you might have heard about this cool little device that they developed, the AVO system. Now, the AVO system is a device that is sent home with orthodontic treatment, either in braces or clear aligners. And what the device actually does, this disruptive little piece of technology does, is uses ultrasonics. Now, these guys have done all the work to get all the evidence and all the case study to back this, and is actually a Class 2 medical device. So you actually have to be approved by Smile Sonica to use the device in practice. So it's a Class 2 medical device, uses ultrasonics. It biostimulates osteoclasts and osteoblasts. So the result of that is, and there's studies and evidence that's backing this up, is that it's reducing mid-course correction and a treatment refinement. This is a huge one. They're seeing, and one of their case shows this, that they saw a 220% reduction in root resorption. So that's huge. That's a huge number. That we're talking about long-term health of the patient. And also, we all know that these long cases, they go on for a long duration. What the device is actually doing is reducing. Okay, and it's all backed by the numbers too. It's reducing that treatment duration. So, you're seeing those Invisalign trays changed over 7 to 14 days. They're actually changing them in 3 to 5, which is mind-blowing. It's doing it more predictively and safely. Also, what they're seeing is mid-course corrections and a reduction in mid-course corrections and a treatment refinement. So we're talking about great savings for the patient in terms of their time and chairside time. That is our sponsor. To check them out, click on the link below, check their website out, and let's get the show going. Welcome, everybody. This is episode, I have no idea, it's 120 something now. I'm Mark Wagner. This is DentalBytes. It's hot. It's really hot in the studio today, like exceptionally hot. So what do you do when it's super hot? Well, first, you fill yourself up with a nice beverage. It might be alcoholic. It might not be. We'll just leave that for your discretion.
Yeah.
But you also fill the room with as many people as humanly possible. I have in studio everybody today, and look at this camera angle. There's Dr. Edmund Liem sitting right to my left here. But we have the whole management squad from the camera angle. What would that be? From right to left, we have James Neuber, David Neuber. They are brothers, and they mentioned that they bathed together.
Yes. We did.
Not recently.
Before we were 10 years old.
Yeah. And Dr. Edmund Liem. And also, we have an additional guest, just to make this like as complicated and complex of a production as possible. We are joined today by Dr. Dennis Marangos in the big smoke over in TO that's just been flooded, actually, he was mentioning.
Yeah.
Yeah, we had a big one. We're okay now.
That's good. Did you have any delays of patients coming in?
Oh, yesterday? Oh, yeah, definitely. Yesterday was awful. And our morning got destroyed. But it allowed us to catch up on a few things, and the afternoon was business as usual. And today, not only was everybody there, they were early because everybody was afraid of coming to downtown Toronto for fear of missing the appointment.
Right.
So it was good.
So we're going to talk about Dentafor. So Dentafor, like I've learned more about the jaw joint in the last 4 years. like I feel I can talk expertly about it. I've been through Dental 4 runs in 2 courses. There's a there's phase 1, which Edmund runs, and then phase 2, which Dennis runs. And it's a fantastic course run by a fantastic lab. We're going to sort of get into how that whole dynamic works. So jaw joint, Edmund, you showed up a little bit earlier. We were talking about this, and just in terms of, even just all the orthodontics that's happening out there. Occlusion is the plane, the occlusal plane, and where things sit is and the TMD is leading to all sorts of really interesting things, terrible things for some patients. I really want to dive into how phase 1 and phase 2 would help. David, you're going to love this. Would help a dentist get to the top 10% in the field. And I'm gonna kick it over to you, David, because I know you've been too quiet for too long already.
I'm gonna interrupt for 1 second before Dave takes off. I learned from a guy many years ago. There's a few things that commonly are not talked about in the dental community, and that's sex, politics, religion, and occlusion.
Yeah. So, and like, James, why is that? Why can't we have that open discussion about occlusion?
Well, because, when Dave and I started our whole AACD journey back in the 90s, and Dennis, you were in that same journey too, going through accreditation and stuff. We didn't even have the health factor on the radar yet. We just need more room. So when it comes down to, well, doctor, we need more room, just open the pin on the articulator a couple mils and go ahead. Like, that never works in the human body, arbitrarily opening the pin on an articulator.
Unless you want to grind it all in.
Unless you want to grind it right back to the metal. So we went on this journey to figure out what is the most proactive way to open a vertical dimension conservatively to restore restorations that won't break. That at the time was our quest. Through that, we learned about all the health factors, airway and jaw joint health and happy muscle health that aren't stressed, dealing with bruxism through the night, because we wanted our restorations to succeed long term, not in 6 or 8 years. We want it 15, 20 years.
Yeah, that's our goal.
And so then the cosmetics come into play. And so when we were taught by James Carlson way back in the beginning of our journey, he was the first one to say, open the bite, train the neurology of the body into this new vertical dimension, then restore once you've reached maximum medical improvement.
To a nice level plane of occlusion.
Level plane of occlusion, cosmetics, and now the longevity of anything we make is now outlasting patients. Yeah. You want your restorations to outlast your patient. That's the ultimate goal.
Isn't that the way it should be? Like that, like you should maximize?
But
that's where we want to go.
90% aren't doing it that way.
No.
Why?
They're winging it.
They're
winging it. There's a course called Winging It, and it's free.
I've taken that.
It's free.
It's free.
Yeah, it's free. I've taken that.
Mark, most dentists struggle with this because they don't have systems.
Systems are
correct.
And one of the systems that I use, and I know David and James are familiar with John Coyce's protocol, where you start with perio, function, biomechanics, and then the aesthetics.
Brilliant.
So when you're presenting to the patient, you start from the face back, which then you go you go from the cosmetics to the biomechanics to the function to the perio. But when you treat the patient, you treat them from the perio to the function to the biomechanics, and the aesthetics will fall into place. So most dentists have no concept of a system. And one of the things that Edmund teaches and I teach are systems that you can take home Monday and get your entire staff on board on something. Even we talked about how to answer a phone at one of our last podcasts.
Yeah, we did. And it was a great, really good conversation. Yeah. Bring a CDA to this course.
Absolutely.
Do yourself a favor. it's a lot of information. You need your team to understand the information if you're going to be successful with it too.
Yeah.
Love it.
I
Edmund?
agree.
Have any
Oh, yeah.
closing remarks?
Closing.
This
What
is
I-
no pressure, no pressure.
Yes, whatever stage you are in your dental career, this is one of the biggest steps to will be a complete person, a dentist who can deliver complete care. You need to look into that. We will be looking into airway. Airway is the biggest dominator of what triggers TMD problems. So you need to understand that part. You need to understand the pathophysiology of that, the progression of that part. And being able to do that will improve your, how to call it, the doctor part of dentist to a different level. You are not a tooth doctor anymore. You are not a tooth carpenter, because tooth carpenter is a technical thing. No, you need to start thinking. You need to ask yourself, why is this happening? And you will be able to do better care for your patients, and they will love you.
Isn't that what it's all about? I don't
It
know.
is.
That's what I think. I don't know.
Yeah.
Guys, this has been awesome. Dennis, it's always a pleasure.
Same here.
Ocean Ceramics in
Yeah.
Aldergrove, BC. Check them out if you need them in your lives. Dentifor, let's get some dates. When's phase
October
one?
the
October
4th.
4th and 5th.
October 4th and 5th, and phase
And
2.
then November 14, 15.
So it's bam bam. Let's sign up for both of those. Bring your
15,
CDA.
16. I'm sorry, you're correct.
And what does it cost to sign up a CDA as well?
It's $500 for the course.
Yeah.
Okay, for the CDA. But you know
Fully
what?
worth it. Fully
The
worth it.
Early registration promo, it's almost a wash. So don't worry
Yeah.
about that.
Arguably, I've been through these. I think that is mission critical in this
Mhm.
course. Bring your CDA. Guys, this has been an absolute pleasure. Edmund?
So,
It's a
Mark,
pleasure being
is
here.
it good for if anybody's possibly interested? Just how would they respond through Dentist on Demand? The
You know-
best way, because
well-
we don't have our contact info up on the screen.
Well, it will all be tagged in this. So check out Ocean Ceramics, contact them, or contact me on any of my channels or the Dentist on Demand
Great.
channels.
Awesome. Okay.
And I'll gladly send people your way.
So everyone shouldn't reach out to Edmund then?
They,
Yeah.
they should actually. If everybody
Dr. Liam at gmail.com.
correct Edmund. Does anybody have any final thoughts before we?
I'm
we,
good. How are you doing there, Dennis? Any closing thoughts?
Dennis always has some final thoughts.
Well, there's always lots of fun thoughts. I was just going to go see if the Leafs signed anybody interesting.
Did they get rid of Marner or what? Is he gone?
Well, I don't know, not yet, but it's always lots of fun thoughts. And
Yeah.
I learn as much presenting these courses as I do taking courses, and I don't think we've met so many enthusiastic people.
Yeah.
You know what my goal is? My wish here is that there's enough staff that come with their doctors that we have to take the course to a different location.
Yeah,
so
needs
that
to be.
yeah, that would be great.
Okay.
That would be a great goal for all of us.
Yeah.
And I'm looking forward to another fun time in November, and Edmund's program. Because they're so close, I think that's a brilliant
Yeah.
move.
So.
We're
Yeah.
looking forward to it.
Yeah.
The
I keep-
material will stick.
Fresh in your mind. No, I honestly, like, yes, it's a lot of info, but to get it that close in proximity,
Right.
that would be it. I think that's going to be a good thing.
Wonderful.
Yeah.
Right on.
All right, thank you very much. This
Thanks,
has been
Dennis.
Thanks,
another
Dennis. Thanks,
Take
Edmund.
care,
DentalBytes.
guys. Have a good one. Enjoy the rest of your summer.
Okay.
There we
you
go.
too. All right, my man.
Here.
Stay
Ciao for
dry.
Yeah. Or go for a little river cruise down your highway there, Dennis.
Down my front street,
Yeah.
the road in front of my house.
Yes.
My boat.
Get your kayak out, Dennis.
or AVA or any of that information. So it's, I love the technology. It does help, and it keeps me motivated to keep learning. For another example, and I'm just looking at this now, is doing DNA testing in the office to assess for risk factors for periodontal disease and caries.
Yeah.
How
Cool.
would you guys like to know if the implant you're putting in that patient's going to fail before it fails based on their DNA?
It's amazing. Yeah. And essentially what you've done is you've kind of transcend from being that single unit dentist to you're looking at the mouth as a full functional unit. And David, and I've been at desk where you're working on, everything in excursions and how the teeth are moving together, and if things are off, they chip and crack. Like, speak to that. Like, how important is it to look at the entire two arches working together?
Well, once doctors learn and understand how to optimize a new or verify, first of all, that their new VDO is got an optimized airway and or jaw joint, that the function is all optimized, that's when we go into engineering occlusion.
Yeah.
And our philosophy is really not any different as far as engineering occlusion than any of the other, call it camps or schools of training. Everyone wants a level plane of occlusion, okay? And but what we do, we take it a step further and look at the condylar eminences of each unique patient when provided, and then what we'll do is we'll design an occlusal scheme that complements that, not fights with it.
Yeah.
And so that is something very, very unique. I have not seen many other docs that, from all the various occlusal camps that really talk about that. And we learned that from Dr. James Carlson back in the day, and he was a pioneer in that area, and it works. It works for hybrids. It works for dentures. It works for full mouth reconstruction. It works for, really, that philosophy is sound and true, and you won't get the forces that break teeth if you know and understand it.
I wouldn't even call it a philosophy. It's more of a science.
Yeah,
It's anatomical science.
Yeah. And I've literally seen you guys on the phone in conversations with these folks. Like, Edmund, how important is that laboratory relationship?
You have to be able to talk to the lab, and these guys are really open to everything. I think they might be taking more courses about TMJ and airway than a lot of dentists that I know. So
we've probably taken about 10 times from you.
More.
Or more.
Hopefully you learned something.
I had it 3 times myself. So. Yeah. Like, honestly, the interesting part in this whole dynamic here with this group is, we have some folks moving to the twilight. We've got a new wave of Curtis and Ty taking over,
and young dentists
as well.
Yeah.
Obviously Dent4 is the solution, but where do things go from here? And that's, in your guys' minds, where's this knowledge going to be passed along?
Well, we're trusting that Edmund and Dennis are going to teach into their 90s for starters.
Well, hang on a second. We were just talking about how folks are living to 104, 110. So, we might be able to, Dennis, you're talking genetics. Maybe we can clone you guys or something. I don't know.
But I want to take a step back now that you mentioned younger dentists. So here I got an email on Monday this week. A dentist who's been out about 15 years, sold her practice, and discovered sleep and TMD and wants me to mentor her. I've never met this gal, know nothing about her. I think she just called me. She wanted to talk tonight. And that is one person out of how many dentists do we have who actually understands that this is where everything starts.
Mhm.
So I was talking with David earlier this week, and one of the things that I think, looking back on our experience, I think I've been with you guys now 8-9 years probably.
Yeah.
Uh,
Easy.
Now, back when we did this, and Edmund will verify, and I've got, I'm working on letterhead here from the American Academy of Craniofacial Pain, making some notes here. When we started that journey back in the late 1990s or 2000s, everybody around us knew what phase 1 and phase 2 meant. I will bet you dollars to donuts that if whoever's listening to this podcast, if you've graduated less than 15 years, 15 years ago, you have no clue what phase 1 and phase 2 means, because those pioneers that taught Edmund and myself have now passed, many of them. And we were the beneficiaries of their education, and we understand that terminology. What these younger dentists need to look at, and what we may want to consider changing our verbiage to, is either complete care or comprehensive care dentistry.
Yes.
That involves different levels of treatment planning. There you have, before you're going to do a full mouth rehab, that's when you're doing phase 1 treatment.
Yeah.
Optimizing the joint, understanding what appliance progression means. What do you need to do to get to that point before David and James can do a wax up for you?
Right.
So we have to now understand that. I think some of the numbers I've seen, the percentage of dentists that are out less than 15 years outnumbers Edmund and myself's generation. Okay. So, and they don't get it. They really don't understand this, but comprehensive care and complete care. If you understand what you want your practice to become, then you have to find this journey. And it's not, I've been looking, and it's not as easy now to find these courses than with Edmund and myself. We were out every second week somewhere. I would see Edmund more in some city in the States than
Why is it? Why is that fading? Is everybody's focused on just
working
these implant courses, the
Invisalign.
the
Invisalign,
CE competition?
yeah, like why is it? Is it because it's too hard?
it's not
You know,
hard.
It's
Yeah.
not sexy.
It's
This
not
is
sexy.
Yeah.
Yeah.
Not sexy. Yeah.
Is
Yeah.
there too many like liabilities in rolling it out? Like, is that a part of, like, is it? No.
You
Hey,
got
Dennis,
more.
sorry.
You got more risk in doing implants than you
Yeah.
do in what Edmund and myself are doing.
So is it a time thing? Like, for an implant, you're if we're looking at it as chair time versus production dollars, is it that?
Oh, okay. So how do you get to production dollars? Okay.
Dollars
So
per hour,
production, like, I do very well in my TMD practice. I mean, there's no issue with, because I charge what I'm worth.
Yeah.
Okay. And patients tell me that. Okay. So here's the typical scenario with a dentist. The dentist says, I got no time to introduce this into my practice. So my question then is, so what are you doing? And you look at their day sheet, they're doing a DO for an hour, then they're doing an MO for an hour. They can't even match their production to cover their overhead doing single restorations. So when you start teaching comprehensive care, you start worrying about production per hour, and you're kind of doing a little bit more than just one tooth at a time. So the first thing new dentists need to do is look at their scheduling and figure out how to do this. Many years ago, I moved my TMD practice out of my general practice because it was taking up too much of my time in my general practice. So I have a separate location for that. And people are like, well, how do you make that work? Well, I think I just found out today my next new patient appointment is November.
Yeah.
Okay.
Wow.
Because there's not enough of us doing this.
So this is like glaringly obvious to me. Like, and I've been through these courses. I've been. I think I've done recorded and sat through
Broadcast.
and broadcast, and it's an amazing course. Like, I implore the whole dental community, if you've not, like, check it out. It is definitely worth your time. I see an amazing opportunity for a young dentist to pick up the torch with what these two fine gentlemen have given to the dental industry and take that into the future. That's what I see.
Hey, Mark, I was wanting to ask Dennis. Dennis, you got that chart that you pull up in your course talking about the evolution growth curve of a young dentist. Like, reference that, because that dovetails nicely what Mark was just saying.
Sure. So it's it's a bit of a take on the have you heard the 10,000 hour rule to become an expert at anything?
Yeah,
it takes 10,000 hours. And when we got out of dental school, they typically said that it's going to take you about 5 to 7 years to get comfortable doing dentistry. Well, guess what 5 to 7 years works out to? Almost 10,000 hours. And at that point, you've learned a little bit. Like Edmund said earlier, you learn from your failures. So the evolution is, by the time you've hit that 10-year, you see something in your practice that you don't like anymore. You know it's not working. And then you come across some educator that changes your mind, opens your eyes. These two courses that we're doing will change your mind. And I hear that all the time at the end of our 2-day course, because typically, here's what a dentist will do. They see a new patient today. They won't set up a separate appointment to do a treatment consultation, but let's say the treatment plan is $10,000. The insurance coverage is only $2,000. So what does the dentist do? He does the $2,000 that the insurance covers and leaves the $8,000 of dentistry on the table. I got news for you. When you're talking about oral health issues, they don't get better with time if you don't do something. In fact, they're going to get worse. And if you want to build trust with your patients, you give them the whole treatment plan up front, and then you let them decide what they want to do. And then in this course, and I've revamped my course to talk a little bit more about how you present these cases and communicate to the patients, because that's one of the things that I find is glaringly missing. Yeah. The younger dentists don't know how to present a case properly to the patient.
Well, and there's those 32 hours of the course, come Monday, that's a lot to take in and then implement.
I can speak to that, Mark.
Yeah,
That's
please.
one of the beautiful things that from this, because our team, James, Curtis, Tyrell, and myself, we're 4 facilitators basically of the course. We're the ones that are that golf coach, flight coach, whatever you want to talk after the course to help implement this stuff.
Yeah.
And, and if we can't don't know the answer to something, I can promise you, I've never seen Dennis or Edmund not take an email or a call eventually to help address those issues.
Yeah.
You don't get that with the big kahunas in occlusion dentistry for the most part.
No. Yeah.
Unless you're in an elite circle.
You get access to the Facebook page. That's about it.
Yeah.
And we're very proud of that. And that's the humility that these extraordinary teachers bring to the table.
Yeah.
And obviously, that, like I said, we've been through this course. We know it extensively. We know the material. We can help implement 99% of the stuff. And for the few percent that we don't, that's when we know we have Edmund and Dennis in our corners to help us out.
So you just beat me to my next piece. So thanks.
Okay.
Yeah, you already like that. I've seen it. I've seen it firsthand.
Yeah.
Right.
Right.
So, it's all about that Monday after the course, right?
Right.
Like the conversations, and I've been in a practice with you where it's a whole team buy-in with this stuff.
Yeah.
But Mark,
yes.
I'm going to interrupt because this is a very important point. The whole team buy-in. How can the whole team buy in if the whole team is not at the course?
That is absolutely correct. Yes, I fully agree with that. Everything that I've seen work clinically, the whole team knows how to have that conversation. The whole team.
Right.
from the
when I-
hygiene chair to the front end, everybody.
Absolutely. Because when I started this journey with the AACD, my staff and myself, I took them to every single course I went to.
Yeah.
And they knew that I'd come back, and we're not going to implement everything. We're going to implement a couple of things that supplemented what we were already doing.
Yeah.
But in our programs, very few of the doctors bring the staff.
Yeah. Well, Dennis, I was just in Midland, Wisconsin, in a practice, Total Dental Care. Dr. Clark takes his CDA to every single course. I think that is mission critical.
That's
Like,
right.
You have somebody, another perspective, a team member that can help you execute. Doesn't that make so much sense?
Yeah.
It is the staff.
Absolutely.
Yeah.
It is the staff that really makes sure that things work. There's a running joke about whenever the dentist completely fired up after a great course with a lot of information,
Yeah.
coming in Monday, like glooming and everybody kind of looking at them. Okay, what's going to do today, this week? So one of the seniors, CDAs, will kind of tell, don't worry about it. By the end of the week, he will calm down and everything is back to normal again.
Same again.
Yeah.
So
Always.
That's what you call the tail wagging the dog.
Which is just it kind of upsets me because I see both of you guys through phase 1 and 2 pouring your hearts out to this group of people. Like, it shouldn't be that. It should be the information should be retained. There should be at least a CDA alongside that could help them on that Monday. That's
Well,
what I
and the CDAs will also figure it out, guys. If we want to implement this, where our weak points are, they're part of the whole journey.
And Dennis, you've alluded to this like in several conversations. Like you can't do this all by yourself. Like you need the team. You need a team. You need, even outside of your practice, you need extra people coming in and supporting you. You can't do it all on your own.
Absolutely. I mean, my journey started back, and it was about 93 with the first, I'm going to call it a management company that helped me understand the business of dentistry.
Yeah.
And then from that point on, if I didn't take my staff to those courses, no, they wouldn't buy into any of this, right? So these courses, like on my course in November, the first day, the morning, every doctor that signs up for this course should bring his staff.
Yeah.
Because that is what they're going to take away. And I got news for you. If they're there for that first half, they're staying for 2 days because they're not going to want to miss a thing. Okay. Yeah. And this is where the excitement happens. And the one question everybody who's talking to a dentist, and Mark, I know you're a marketing guru. The one question you need to ask your dentist, well, amongst many, but this one is a good one. Have you reached a production plateau? Think about that, because a lot of dentists think they're busy and too busy because they've reached a production plateau. Guess what? Nobody reaches a production plateau. You're just too busy filling your chair with butts and not producing properly.
Yeah.
And that production, so we started, when we implemented some changes in our schedule, we actually started keeping the practice open fewer hours, and we were making more money.
Yeah.
Huge.
So
yeah, and it's the dentistry you're doing. And even like I'll speak to what Dr. Clark was like. They don't want to do single unit dentistry.
no,
They want to
it's
look. They want to look at the full mouth. They want to bring people in and do a full, if you're getting caries or whatever, that's fine. Like obviously hygiene's a big deal, but let's look at the full mouth and the mouth body connection. And that's where, as Dentists on Demand, I'm like, that's been my mission, is to talk to that point. But again, like, you need the people. You need an awesome lab too. Like,
So, Mark, I got a question for Dennis.
Go for it.
And
Yes.
Edmund. Okay, of the patients that come into your practice, so you each have a TMD airway practice, and then Dennis, you have your general dentistry practice,
Mhm.
what patients are coming in and why would they come in for a smile as opposed to, say, a patient that comes in to your TMD practice and says, I'm in pain, and out of that treatment protocol, it evolves into a smile.
Yeah.
You need to get all these restorations done to open up your vertical dimension, and you may as well get a new smile in the process, because we need to fix the back teeth, as opposed to, say, a patient that comes in and says, well, I want a nice new sexy smile, and then you have to go the other direction and go, well, we actually have to open your bite in order to give you longevity restoration. You know, that there's two different angles, but what could you guys comment? Because I know, Edmund, you've done arches. We've done arches for you in the past. And,
Yeah, in the past.
and you know, like, where did the motivations begin?
Really depending on how your office is set up. My office at this time, the people that I see, they only have problems already. Okay, so you cannot compare it to general dentistry. With general dentistry, what you should do is basically on every existing patient that you have, yes, you don't need to market to the outside. You look into your own pool, yes, get them that questionnaire to have them filled out, yes, and their eyes will open. And I said, I did not know I had these issues, but why are you asking these issues? Okay, so I'm not looking into the patients from the outside in the general dentistry. Start with your own patients, because you will be surprised how many of those patients are
Need help.
in need of help.
And Dennis, we talked about this in our last conversation. You said something along the lines of, if you have 1,500 patients in your patient base, you're set. Like, the dentistry that you can do and taking care of those folks that are in those 1,500, you're set for life, essentially.
So essentially, yeah. So I about 2 years ago stopped taking new patients unless they were referred to me by an existing patient or a family member of an existing patient. And I'm busy. I mean, we're doing stuff, and my TMD practice is different. So James and David, your points about the smile. I had one patient about a month ago. She was a new patient. She was the wife of one of my existing patients, who for 15 years I tried to get him to do ortho, and finally he broke enough teeth that he said, okay, I understand why I need the ortho now. So he sends his wife in, and she's got anterior composites and teeth, everything's breaking, and dentists are doing patchwork. There is no room to put a restoration in. So I'm looking at a full mouth rehab on this lady. So David, it was James. I don't get a lot of patients that come in looking for a smile in my practice. I get a lot of patients coming in saying, fix me.
Yeah.
Right.
They're chewing on one side.
Which I see practices out there, all they do is advertise, get your new smile from us.
Well, right now,
But how effective is that really?
all the bloody advertisement is on Invisalign. It drives me nuts.
Yeah.
Like, because people are looking up the dollar signs now, and that's a scary thing to me when I
Okay,
see
Mark.
people do. Go ahead. Sorry.
Okay, Edmund and myself were taught traditional orthodontics, straight wire, appliances, orthopedics, and people will come in saying, I need Invisalign.
Yeah.
Well,
Sorry,
hold on
your
a
gums are falling apart, but go ahead. Yeah. I want
Invisalign.
veneers, but I've got nothing to put those veneers on, but sure.
Invisalign is not a diagnosis.
Right.
Invisalign is a method to achieve a diagnosis and a result.
Yeah.
What you need is orthopedic correction of whatever the problem. You need to put the teeth in the right space. Oh, and by the way, we might be able to do that with Invisalign.
Yeah.
So
Yes.
they're doing a great job on marketing.
Yeah.
Because when somebody says my diagnose, or doctors in our courses will say, well, they need 10 veneers. Well, what's your diagnosis? Well, no, they need 10 veneers. Okay, that is not a diagnosis.
No.
is a
It's
treatment?
porcelain
Is your
deficiency.
Well, I
porcelain-
think the right answer is multidisciplinary dentistry.
absolutely.
And let's look at the whole picture of what's going
Absolutely.
on, and let's look at that foundation, which is phase one. Let's look at the foundation and make sure we're okay to restore to that.
Correct.
Yep. It's you got two jobs to do on phase one. Get them out of pain and getting normal function.
Right.
And the rest is easy.
And guess what? The first thing that my patients, almost all the full mouth rehabs I show in my course, all started out as TMD pain patients, because the minute they feel good, they want to look good.
Yes.
Right.
Right.
If they're
Good
in
point.
pain, they don't care because they're in pain.
Yeah.
They're in pain, right? So and unless we ask the patient, they're not going to tell us anything.
Well, and like there's numbers floating out there, like 25% of the population suffers from some varying degree of sleep obstruction. Right? Like that's years off of lives we're talking about. And this whole oral health body connection is, I think mission critical. I think we need to be talking about more about that than going to Turkey to get some nice looking veneers because they're cheaper over there.
Or hair implants.
That while you're there, there's actually, I've seen an advertisement where they do both. They do the veneers and the hair implants.
It's the hair implant central of the world.
God.
Oh yeah,
Anyways, so
there's so many things that we're touching on, and Edmund's phase one goes back to the days of the Dawson days. Okay, and there's a textbook for any new dentist, and I think it's still in print, and it's about functional occlusion and aesthetics, and Pete Dawson has since passed. So a lot of the young dentists today will hear the name, but unfortunately will not get the opportunity to listen to that man. And he laid such a foundation for all of us. And sometimes it's what you learn, and then you go back and you say, geez, I forgot that I learned that, but Edmund reminded me about something. We have the John Coyces, we have the Spear programs, we have Pankey, and we still have the Dawson Academy. There are so many places that dentists can go to get this understanding of complete care dentists. So yeah. I'm gonna put this out there for everybody. Anybody who signs up for Edmund's course or my course, guess what? These are not the last courses you're going to take. These are the first courses you're going to take.
Yeah, I completely agree.
You're going to hate us because you're going to go on this educational journey that's going to take you for a long time to get to.
No, and I want to stop you there. Like, and everything that I've learned out there, the people that are actually enjoying their dental careers are the ones that are doing the courses. That's what I've seen. The more you know, the more the brighter it gets. Like the folks that are just like churning and burning the single unit drill and fills, like, man, oh man, like there's so much, you can do so much cool stuff. You can work with so much cool technology. I have a saying that says, working like that is like eating soup with a fork. You're always busy and you're still hungry. Oh man, that's single unit dentistry right there. Yeah,
single unit dentistry. There you go.
Yeah.
One thing I want to add to Mark is because I'm primarily the front man in the trenches recruiting doctors that come to this amazing course, and the first thing they say, well, I've had this journey with this school or whatever, and I keep saying the same thing, and most of them will agree after they've come to it. This CE is going to add to your, let's call it
foundation.
Your foundation.
Yes.
It's not going to contraindicate and rewrite everything. It's just going to add to your knowledge and base and make you better. It's not designed to say like whatever you learned is wrong. Is to add to it. Yeah. And I think that's really important because Nobody wants to feel like they spent bad money on a bad CE. It's just adds to it. It's like anything, you know. It's really important.
Yes, I'm biased. Sorry, I've been I've sat to the courses, and the thing is I know that you guys are genuine about that. Like, you're passionate about it. And where does that stem to? Like, where does that stem from?
Well,
like
these teachers,
the teachers,
there, yeah.
But it goes back to those patients that you're helping.
Yeah, very
like,
true.
how many patients have you changed? How many lives have you changed?
Yeah,
because of the information that you have in your mind. Like, that's the cool part to me. To me, that's the passion. That's the purpose part.
Yeah.
Well, a good story. Dave and I always get people, friends and family, asking for, help in dentistry in general and looking for a referral. So a guy I used to coach hockey with, I actually slept next to him at a hockey tournament once in a hotel, and he woke me up in the middle of the night because he was snoring like a horse. And I'm like, dude, and
you're dying.
I sleep through trains, and I am a very heavy sleeper, and he woke me up.
Yeah.
So we're having coffee in the morning, and I says, Harold, open your mouth. He opens his mouth, and this guy had the hugest tori, the biggest that I've ever seen in my entire life of looking at models on his lower mandible. And I says, okay. I grabbed a pencil out of the drawer of this place we were staying at. And I says, bite on this pencil. He bites on it. I feel his masseter and his temporalis. Shut them right off. I says, lip seal on that pencil. Breathe through your nose. Try and make yourself snore. He couldn't do it. I says, we're going to hook you up with an appliance that holds you at that position. So we made him an appliance, and his wife literally comes up to me in the arena and gives me a big hug and says, you saved my marriage.
Well, you've saved his life too.
That too.
Yeah.
But I've saved 2 lives.
But marriage life, it's interconnected, yes.
Because she could not take it anymore. So just with that one appliance.
Yeah.
And he's since referred his sister and so many other multiple patients that need help.
Yeah.
He's like, it didn't take a magazine to generate that type of buzz. You don't get that type of buzz out of a magazine.
And honestly, that encapsulates what Ocean Ceramics is.
Yeah,
like, you guys, how many years, guys? Like, multi-generational.
1992 for Ocean.
There you go. Like, working with you guys, that is going to catapult your practice as well.
No.
Yeah.
But yeah, in a nutshell, we just wanted to make sure that we had Dennis and Edmund both have a little piece in this presentation to highlight what it is we're going to be doing in, the first one's October 4th and 5th, and Dennis's is 14, 15 of November. It's one of the first times we kind of made it within a month and a half. And I think we're getting a lot of interest, docs signing up for both courses at the same time.
Great. That's
and
good.
So I just want to fuel that. And of course, we have some early registration promotions that, inquire through this, however we make it happen through this, or contact information, which I'm sure it'll be.
Check the show notes.
Yes. And so, and I can't stress enough, it'll be the best CE dollar you will likely invest in your career if you come here. And because I haven't heard one doc that's come out of this program, the Dentifor jaw optimization by Edmund and Dennis's restorative component to a new optimal VDO that you'll ever spend your money on. And
I want to add to what Dave is talking to. In our journey, like when we were going through our AACD years of veneers and the cosmetic revolution, everybody wants to make the smile look good. But then we run into the challenges of room and space.
Yeah.
We didn't even have the health factor on the radar yet. We just need more room. So when it comes down to, well, doctor, we need more room. Just open the pin on the articulator a couple mils and go ahead. Like, that never works in the human body, arbitrarily opening the pin on an articulator.
Unless you want to grind it all in.
Unless you want to grind it right back to the metal. So we went on this journey to figure out what is the most proactive way to open a vertical dimension conservatively to restore restorations that won't break. That at the time was our quest. Through that, we learned about all the health factors, airway and jaw joint health and happy muscle health that aren't stressed, dealing with bruxism through the night, because we wanted our restorations to succeed long term, not in 6 or 8 years. We want it 15, 20 years.
Yeah, that's our goal.
And so then the cosmetics come into play. And so when we were taught by James Carlson way back in the beginning of our journey, he was the first one to say, open the bite, train the neurology of the body into this new vertical dimension, then restore once you've reached maximum medical improvement.
To a nice level plane of occlusion.
Level plane of occlusion, cosmetics, and now the longevity of anything we make is now outlasting patients. The you want your restorations to outlast your patient. That's the ultimate goal.
Isn't that the way it should be? Like that, like you should maximize?
But
that's where we want to go.
90% aren't doing it that way.
No.
Why?
They're winging it.
They're
winging it. There's a course called Winging It, and it's free.
I've taken that.
It's free.
It's free.
Yeah, it's free. I've taken that.
Mark, most dentists struggle with this because they don't have systems.
Systems are
correct.
And one of the systems that I use, and I know David and James are familiar with John Coyce's protocol, where you start with perio, function, biomechanics, and then the aesthetics.
Brilliant.
So when you're presenting to the patient, you start from the face back, which then you go from the cosmetics to the biomechanics to the function to the perio. But when you treat the patient, you treat them from the perio to the function to the biomechanics, and the aesthetics will fall into place. So most dentists have no concept of a system. And one of the things that Edmund teaches and I teach are systems that you can take home Monday and get your entire staff on board on something. Even we talked about how to answer a phone at one of our last podcasts.
Yeah, we did, and it was a great, really good conversation. Yeah. Bring a CDA to this course.
Absolutely.
Do yourself a favor. It's a lot of information. You need your team to understand the information if you're going to be successful with it too. Yeah.
Love it.
I agree.
Have any closing remarks?
Closing.
This is no pressure.
Yes, whatever stage you are in your dental career, this is one of the biggest steps to be a complete person, a dentist who can deliver complete care. You need to look into that. We will be looking into airway. Airway is the biggest dominator of what triggers TMD problems. So you need to understand that part. You need to understand the pathophysiology of that, the progression of that part. And being able to do that will improve your, the doctor part of dentist to a different level. You are not a tooth doctor anymore. You are not a tooth carpenter, because tooth carpenter is a technical thing. No, you need to start thinking. You need to ask yourself, why is this happening? And you will be able to do better care for your patients, and they will love you.
Yeah. Isn't that what it's all about?
It is.
That's what I think. Yeah. Guys, this has been awesome. Dennis, it's always a pleasure. Ocean Ceramics in Aldergrove, BC. Check them out if you need them in your lives. Dentifor, let's get some dates. When's phase one?
October 4th and 5th.
October 4th and 5th, and phase 2.
Then November 14th, 15th.
So it's bam. Let's sign up for both of those. Bring your
15,
CDA.
16. I'm sorry, you're correct.
And what does it cost to sign up a CDA as well?
It's $500 for the course.
Yeah.
Okay, for the CDA. But you know
Fully
what?
worth it. Fully
The
worth it.
Early registration promo, it's almost a wash. So don't worry about that.
Arguably, I've been through these. I think that is mission critical in this
Mhm.
course. Bring your CDA. Guys, this has been an absolute pleasure, Edmund.
So,
It's a
Mark,
pleasure being
is
here.
it good for if anybody's possibly interested? Just how would they respond through Dentist on Demand? The
You know-
best way, because
well-
we don't have our contact info up on the screen.
Well, it will all be tagged in this. So check out Ocean Ceramics, contact them, or contact me on any of my channels or the Dentist on Demand
Great.
channels.
Awesome. Okay.
And I'll gladly send people your way.
So everyone shouldn't reach out to Edmund then?
They,
Yeah.
they should actually. If everybody
Dr. Liam at gmail.com.
correct Edmund. Does anybody have any final thoughts before we?
I'm good. How are you doing there, Dennis? Any closing thoughts?
Dennis always has some final thoughts.
Well, there's always lots of fun thoughts. I was just going to go see if the Leafs signed anybody interesting.
Did they get rid of Marner or what? Is he gone?
Well, I don't know, not yet, but it's always lots of fun thoughts. And
Yeah.
I learn as much presenting these courses as I do taking courses, and I don't think we've met so many enthusiastic people.
Yeah.
You know what my goal is? My wish here is that there's enough staff that come with their doctors that we have to take the course to a different location.
Yeah,
so
that'd be
that
sweet.
yeah, that would be great.
Okay.
That would be a great goal for all of us. Yeah. And I'm looking forward to another fun time in November, and Edmund's program. Because they're so close, I think that's a brilliant move.
So.
Yeah.
Looking forward to it.
Yeah.
The
I keep-
material will stick.
Fresh in your mind. No, I honestly, like, yes, it's a lot of info, but to get it that close in proximity,
Right.
that would be it. I think that's going to be a good thing.
Wonderful.
Yeah.
Right on.
All right, thank you very much. This
Thanks,
has been
Dennis.
Thanks,
another
Dennis. Thanks,
Take
Edmund.
care,
DentalBytes.
guys. Have a good one. Enjoy the rest of your summer.
Okay.
There we
you
go.
too. All right, my man.
Here.
Stay
Ciao for
dry.
Yeah. Or go for a little river cruise down your highway there, Dennis.
Down my front street, the road in front of my house.
Yes.
My boat.
Get your kayak out, Dennis.